Hi, my name is Madison Chapman. I am an Education Outreach Liaison at Doylestown Health. And to celebrate Heart Month this month, I have Dr. Renee Sangrigoli. She is a cardiologist with us at Doylestown Health. So, Dr. Sangrigoli, can you give us a brief description of your education, background, and what you do at the hospital?
Absolutely. Hi, my name is Renee Sangrigoli. I'm a cardiologist at Doylestown Health. I've been a proud member of the Doylestown Hospital staff for the past 20 years. I initially did my medical school training at Temple Medical School. I then stayed at Temple and went on to do my internship, residency, and cardiovascular fellowship at Temple University Hospital. I'm board certified in cardiovascular diseases, heart failure and transplant, hypertension, and nuclear medicine. I've also run for the past 20 years the clinical research program through my practice at Doylestown Health. I see all types of cardiovascular patients with a special expertise in heart failure and also now cardio-oncology.
So, that is a great segue into what we will be talking about today, which is cardio-oncology. It is a new sector of cardiology, so how would you describe what cardio-oncology is?
Absolutely. Cardio-oncology is a new field in cardiology. It's been around for the past 5 or 8 years, and it grew out of the fact that there are many new treatments available for cancer patients, so we're lucky in that regard. Cardio-oncologists work hand in hand with oncologists. We have special knowledge and special interest in caring for the cardiac side effects of patients undergoing cancer treatments. We're very fortunate in our area because there are not many cardio-oncology programs in the United States because it is such a new field that we are there to help serve our community and make our patients safe.
So, since it is a relatively new field, how and why did this get started?
Well, the number of cancer patients and cancer survivors continues to grow. Cancer survivors in 1975 were approximately 5 million. Currently, there are about 18 million cancer survivors, and it is predicted that in 2040, there will be 26 million cancer survivors. Our group started our program given the gap in healthcare that we saw in our community with the large number of cancer patients and cancer survivors. We are lucky. There are many new cancer treatments that have emerged and have caused a shift in treatment of previously untreatable cancer to now cancers that can be successfully treated. However, with the new treatment come the risk of potential cardiotoxicity, and we're here to help with that. Our comprehensive cardio-oncology program was formed initially in the spring and summer of 2020, and we sprung into action in the fall of 2020. We ourselves are a very multi-centered group. This group includes cardiology, oncology, radiation oncology, breast surgeons, radiologists, pharmacists, and many others that make the program a success.
So, there are a lot of moving parts and a lot of people in this cardio-oncology group that I see. But what cancer therapies put patients at risk for cardiovascular disease and also to be included in this into this cardio-oncology program?
Well, this is a busy and a complicated slide, but many potential cardiac problems may occur in patients undergoing cancer treatment or after cancer treatment has done in the long term, including coronary artery disease, which is blockages of the arteries of the heart, rhythm-related events, blood clotting events, high blood pressure, or heart failure. So these are the things that we want to watch for and monitor, whether it's during therapy or long-term after therapy. There are many common medications that are used for cancer that can lead to problems with patients, especially cardiac problems. They include for breast cancer medicines like doxorubicin or Herceptin. In the GI realm, this is 5-fluorouracil, which is one of the very popular medications that is used that can have cardiovascular side effects. Prostate cancer patients undergo hormonal manipulation and hormonal therapies, and this can lead to some of those effects. Also, the newer immunotherapy medications and radiation therapy can have these side effects.
So, what are these shared risk factors of developing cancer and also cardiovascular disease?
So patients who have cardiovascular risk factors seem to have shared features with those who develop cancer. So they both have family history, age, smoking history, hypertension or high blood pressure, high cholesterol, and diabetes as shared risk. We want to identify and modify those risk factors, especially given that patients who are cancer patients and undergoing treatment, if those risk factors are not identified and treated, they have a higher risk of cardiovascular complications during treatment.
So what can patients who are diagnosed with cancer, what can they do to prevent any sort of cardiovascular disease?
The first thing is they need to talk to their oncologist about any side effects that are potential with their cancer-related treatment for the short term and for the long term. Then their risk factors have to be watched: blood pressure, cholesterol, diabetes, and they need to be modified, treated, whether it be with lifestyle, exercise, medications, and follow throughout their whole history of cancer and into what we refer to as survivorship. In addition, patients need to look for new symptoms, whether it be new chest pain, new palpitations, new shortness of breath, and really report these promptly to their provider.
So when would someone be referred to you as a cardio-oncologist?
There are generally 5 types of patients that we see: those at increased risk who are undergoing treatments with potential cardiac effects are one of the biggest group that we see. And these could be patients who have had prior coronary disease or who just have risk factors like hypertension and high cholesterol. We also see patients who are receiving more than one treatment that can affect the heart. For example, breast cancer-related chemotherapy and radiation therapy can both affect the heart, and those patients are seen in our clinic frequently. Patients who receive certain cancer therapies that require frequent echocardiograms or ultrasounds or EKGs for monitoring are seen in our clinic, and also patients who develop symptoms of any type of the cardiovascular nature while they're undergoing treatment. Lastly, we see patients who are survivors of cancer, patients who have received cardiotoxic chemotherapy, radiation therapy, or immunotherapy. We like to see them as they're undergoing treatment and then in the long term. And this can actually even include patients who have survived childhood cancer, because childhood cancer survivors 10, 15, and even 20 years down the line are at increased cardiovascular risk.
So we've talked about all the moving parts that are involved with cardio-oncology. What is the flow of patient care from when someone is diagnosed with cancer to when someone would see you?
So the oncologist or breast surgeon will identify a person as increased risk based on what type of chemotherapy, immunotherapy, or radiation therapy the person is going to have. They also do a preliminary look at their cardiovascular risk factors, and if the patient hits one of those target categories, then they are referred through our clinical care coordinator, Cassie Richmond, into our program at that point in time. Before they come into the program, Cassie looks them over to make sure they don't have to undergo preliminary testing like echocardiograms, EKGs, or blood work to look at their cardiovascular risk. And then we talk about their particular risk as identified at the office visit and make a treatment plan.
So then what is your role in a patient's care?
When a patient is referred, I help safely get them through their chemotherapy, immunotherapy, or radiation therapy from a cardiac point of view. We watch their blood pressure, and we self-teach the patients how to check their blood pressure and notify us if there are any issues. If they do have problems with cardiovascular toxicity, we try not to take them off their chemotherapy or immunotherapy, and we try to work with them to get them through safely and protect them. In addition, we're there for the long term, whether it's 5 years, 10 years, or 20 years or more, to make sure that they have heart health throughout survivorship.
So why should someone come to Doylestown Health to receive treatment?
Well, the biggest reason is that we're a great program. We are one of the only programs in this area for cardio-oncology, and we have a very talented multi-specialty group that could handle any of the problems that arise in our patients from a cardiology, oncology, or extended group focus. In addition, we have many evaluation and treatment modalities available to patients, from EKGs to echocardiograms to MRIs, and some newer technology like which is shown on the screen. This is an example of what we call strain imaging. It's an echo modality that's a newer modality and not available everywhere. These echo modalities are able to, more at a microscopic level, detect cardiovascular dysfunction before we have decrease in heart function in any patient, but in a particular setting, our cardio-oncology patients.
So what are some key takeaway points that you want the viewers to know about this new cardio-oncology program that we have?
Well, it's a very new and exciting time for cancer patients. There are brand new medications and immunotherapies and treatments coming out almost monthly. Patients who had previously untreatable cancers now have treatment options and even cure options. However, patients need to identify what treatments put them at risk and where their risk is. We want to, with patients, make sure that they still know they have to look at their cardiovascular risk factors, make sure their blood pressures are in check, their cholesterol is in check, and their diabetes is in check. We need patients to stop smoking because it is their biggest risk factor for both cancer and also cardiovascular disease. We want patients, in addition, to say, I need to know how to identify if I have a new symptom that must promptly be reported.
So my final question for you today is, if someone is watching and they themselves or someone they know could really benefit from your services, how could they reach you?
Sure, any questions, or if a person feels that they're appropriate for our cardio-oncology services, they can contact us through our clinical care navigator specialist, Cassie Richmond, and here's her card with her contact information, or certainly they can contact Doylestown Health. Thank you.
Thank you so much for joining me today, Dr. Sangrigoli.
Thanks again.